And we are live.
Okay. Hey guys, come on in. I'm going to show you something today. We're doing Botox for hyperhidrosis or for sweating. Initially, when I started doing this in New York a lot, this was before it was well known that Botox stopped sweating. We were using it for runners who were running the New York Marathon and getting a lot of chafing between their legs. So I thought, well, let's try the Botox because it stops sweating sometimes and it really worked. Now we have people that just don't want to sweat a lot. When you do forehead for cosmetic purposes, you tend to find that the sweating goes down, the oil production goes down, acne improves, the skin looks better. But I have a patient here who just sweats and wants it improved. My best friend does this for his whole back. It does hurt a little bit, but it's really quick. You do little blebs, and you guys can see to the majority concentrated area of the glands, really superficial, little injections. And typically, this lasts people 3 up to 6 months in some scenarios. And for him, it's actually lasted a long time. There's not really many permanent solutions. I found actually that the Morpheus treatment really helps this to improve. We've tried liposuction, mirror drying, a lot of different things, and I don't know, I just find that this is just the easiest couple times a year. My best friend comes from San Fran and gets it done, gets a Fraxel too, and he makes it a day. It's really easy, it's really successful, it works in every single patient, and it won't affect the rest of your body, because I know a lot of people get worried about sweating here and whether or not they'll sweat elsewhere more. It doesn't happen, okay? You're totally okay.
I can definitely say from personal experience that if you involve yourself in, over sweating, that this is a game changer.
I know, it changed. It seriously. My best friend has to wear suits a lot, and he sweats a ton in the suits. So this changes his whole life. We've actually done it on his back, which takes a lot of units, but really works. And this is a life changer for some people. So the other thing too is, not that he does, but some people sometimes are a little smelly under here too, because of the bacteria that react with the sweat. It goes away as well. So, good. We're going to go to the other side. That's done.
Do males need more than females?
Actually, no. I mean, typically, the amount of sweating, doesn't matter in terms of the dosage that we use. The studies show that you need somewhere, usually about 50 to 100 units a side, and that will give you that 3 to 6 month time period. You could do something called an iodine starch test. When we did the original clinical trials, we used to do it. It's just a mess. It gets everywhere, and the sweat turns purple. And so you can actually see where people sweat more and concentrate the Botox to that area. I just find it so much easier. You concentrate in the middle, you're working your way out, especially people that have a little more body hair in this area. Hair removal and sometimes microneedling radiofrequency can help with sweating. I've done hair removal and it actually did help a little bit, but the sweat glands typically don't fully go away when you remove the hair. So you may still sweat even with the hair removal. This is a sensitive area. He's actually doing really well. I'm trying to concentrate the majority of the Botox in the middle. And if, let's say he did do it and he still sweat a little bit, you can always do a little touch up and then get it to last even longer. Higher dosing typically gives you longevity, not necessarily results. It's more of a longevity. So people will get a big reduction. There's actually this questionnaire online of the International Hyperhidrosis Society. It talks about interference in life. When you do the Botox, people go down by a minimum of 2 on the score typically. So not too bad, right?
No, not at all.
Okay, you did great. That's Botox for sweating, guys. Perfect.